Now for our little segment we call Ask the Experts. Oftentimes I pretend to be the expert on this show about everything, but we actually have some people here who know what they're talking about. We have Dr. Stephanie Salzberg and Dr. Melissa Shaw. Good morning, ladies.
Good morning.
How are you today?
Very good. How are you?
Good. We're going to talk about vascular disease. Now, first of all, what are the risk factors for vascular disease?
Well, when we're talking especially about arterial disease, but also venous, some of the most important risk factors are blood pressure, cholesterol, heart disease, and one of the most important ones would be smoking history.
All right, so all the usual suspects then, huh? Yeah. And is there any family history that plays in on this at all?
Yeah, there is. Lifestyle is certainly a part of it, but there is some family history component to it as well.
I guess what I think people have an idea, but what exactly is vascular disease?
It's very comprehensive. It includes any disease of the arteries and the veins. The arteries are the blood vessels that carry the blood to the extremities and the organs to bring the nutrients and oxygen, and the veins are the vessels that bring it back to the lungs.
Okay.
So it's pretty much any disease within the blood vessels.
Okay. We're getting a call. Let me just grab a call here. Yes, hello, Mix.
I do. I have a question for the doctor. My name is Stephanie. I'm 27 years old. I've never had kids. And I have varicose veins in my right leg, and they're pretty big. I just wanted to ask the doctor, is this something I should get removed?
Okay, all right. Thanks for calling in. We'll talk about it.
All right, thank you.
Okay, so she wants to know about the varicose veins, and she's a young woman. Now, is this common?
Varicose veins are very common, and they're often underdiagnosed. It's thought to be a disease of women, but that's actually not correct. There's actually a fair amount of varicose veins that are found in men as well. It is not significantly dangerous, but it can cause problems, and it can be very symptomatic. So we generally will intervene on varicose veins if the person is having symptoms or if they're having complications from the veins. Now, if you have veins and you just don't like the way that they look, we can obviously do cosmetic procedures for that, but it's not medically necessary. So if the veins are causing symptoms like pain, aching, heaviness, fatigue, throbbing, then that's when we would want to fix them.
Now, doesn't that normally come along with something like varicose veins where people are experiencing some problems along with them?
Not necessarily. There are sometimes that they are just cosmetic, but in a fair amount of patients, they will have associated symptoms.
All right, so if people can, if you have them and people don't mind that they have them, they shouldn't automatically panic and go, wow, is there something wrong with me? Especially in this case, we have a very young woman who hasn't even had kids yet.
Correct. Then she does not need to panic, and generally, if possible, we prefer to actually fix them after she's had children because the pressure of having the baby on the uterus will actually cause more varicosities.
Yeah, they will get worse. We're on with Dr. Stephanie Salzberg and Dr. Melissa Shaw talking about vascular disease. And what are some of the other things that people should know about this that you guys treat on basically a daily basis, I'm sure?
Well, we treat a broad spectrum of vascular disease, obviously everything from carotid disease and stroke to aortic aneurysms to varicose veins. And then one of the most common things that we do see is something called peripheral arterial disease, or PAD, and that's something that some of the listeners may have questions about. Peripheral arterial disease spectrum ranges from something called claudication, which is cramping in the walking muscles, particularly the calf, all the way to something called rest pain, which is constant pain in the foot because of not enough blood supply. And this can also progress to ulcers, or basically tissue loss, and gangrene, which is the blackened tissue that can occur in the foot with a long time of not having enough blood supply.
Now, would this happen with somebody who's probably severely overweight, I would think, maybe diabetic? I don't know.
Diabetes is certainly a big risk factor. Yeah. Obesity in and of itself may not be an independent risk factor for peripheral arterial disease, but certainly diabetes is.
Okay. Anything else to add on that?
And it's very significant in smokers.
Uh-huh.
But these are the types of blockages in the arteries that you hear about on TV and the commercials that you can often balloon or stent open with minimally invasive procedures. And I think that's a very important point, which is that in the past, a lot of vascular disease had to be addressed with big operations. And now they can be addressed with a lot of minimally invasive advanced technologies. So it's important that if you're having symptoms to see it see a doctor, have it evaluated, because there are minimally invasive treatments.
Now, what about people that there's a lot of herbal remedies out there? You know, you see that, you hear about it all the time. Is that something that's effective for people to be taking? Is it bad versus regular medication?
Homeopathic medicines are typically ineffective for treatment for most of the arterial disease and venous disease that we see. For the most part, it may not be detrimental, but if it delays care and diagnosis, it certainly could be.
Okay. All right. So if folks are wondering, you know, if they have some problems, or how do they get in touch with you guys?
Well, we're part of the vascular group. We're a large group of vascular surgeons, and we cover a large part of New York State. Dr. Salzberg and I are mostly in Poughkeepsie, and our office phone number here in Poughkeepsie is area code 845-483-0698. We also have a website for our group, which is albanyvascular.com.
All right, and also they can check you out on the Health Quest website.
Absolutely.
Which is health-quest.org. And get in touch with them, even if it's not you. Maybe you have a family member who's going through some issues, and certainly better get it checked out early than wait, right? Because it can only get worse.
That's right.
Yes. All right, Dr. Stephanie Salzberg and Dr. Melissa Shaw, thanks for coming by and being part of our Ask the Expert segment.
Thank you very much.
All right, great. All right, Mix 97.7, it is 7:41, sunshine today. We'll get up to around 67, and here in Poughkeepsie, 38 degrees at Mix.
Halloween is coming, and